Magandang hapon. Good afternoon to all the participants today. Let us begin this webinar with a prayer. Let us put ourselves in the presence of God. Lord, we just want to say thank you for this life you have blessed us with. It may not always be a life that is trouble-free or a life that is without uncertainties, but we are grateful for our lives. With your help, it has molded us into the people we are today. Bless us, Lord, with the strength and determination to always put our faith in you, regardless of the situation we find ourselves in. Amen. A warm welcome and thank you for spending time with us today. We will be having the second of EBSCO's two-part webinar series titled Back to Back, Let's Get Back on Track, with our topic today on managing emotions in times of uncertainty, strategies, and implications. Today completes our two-part webinar series, which aims to help not only in the aspect of e-learning, as what Dr. Srikumar discussed last week, but also have awareness in oneself from today's talk with Dr. Sudhir. Let us all get back on track. Before we introduce the speaker, we would like to remind everyone of our webinar guidelines. All the participants' microphones and videos are turned off by default. If you have questions on the topic, please type it on the designated Q&A box found at the lower right-hand side of your screen. Questions will be read at the end of the presentation. This will ensure a smooth flow and also not to interrupt the speaker. Certificates and a PDF format of the PowerPoint will be provided through email. Sit back, listen, and have a fun learning experience. And now for our speaker. It is an honor and a privilege to have Dr. Paulomi M. Sudhir. She currently holds the post of Senior Professor at the Department of Clinical Psychology at the National Institute of Mental Health and Neurosciences, NIMHANS. She is a consultant at the Behavioral Medicine Unit, Department of Clinical Psychology, NIMHANS, a specialized unit that provides clinical services and training to postgraduates in the area of behavioral and cognitive behavioral therapies for a wide range of mental health conditions. Dr. Sudhir is also a consultant at the Stress and Lifestyle Clinic at NIMHANS Center for Wellbeing, Bangalore. Her key areas of clinical and research interests include cognitive behavioral therapies, mindfulness-based interventions, emotional disorders, and psychological variables associated with health in chronic medical conditions. She has mentored several doctoral and MPhil postgraduates. Dr. Sudhir has published national and international journals in her areas of interest and is actively involved in training mental health professionals in cognitive behavior therapy through workshops. Ladies and gentlemen, let us welcome Dr. Paulomi Sudhir.
Afternoon. I hope I'm audible.
Yes, ma'am.
Yes. So thank you very much for that warm welcome and the kind words of introduction. I am a professor of clinical psychology, and I think the topic for today is something that's very relevant to all of us. It's a timely topic, but also it's a topic that perhaps is suited for all times because a lot of us go through uncertainties, and I think it's important to be able to have strategies and skills in order to deal with it. So I'm going to take you through some of the learnings that we've had in terms of what creates or who is vulnerable to uncertainty and what are the implications. Also, what we can do at such times to understand how we can help ourselves and also perhaps stay balanced in these difficult moments. So we begin with what we have known in research as the window of tolerance. And this is a concept which is familiar to us in other areas of our learning as well, a construct given by Dan Siegel. What we know is some of us have variations in the way we learn to react to situations around us, and all of us have what is known as a level or a threshold for tolerance, what is known as a window of tolerance. And as we look around us, we know that when there is adversity or any kind of difficulty, some of us react much more adversely than others. At the same time, we also take longer to adapt, in the sense that we take longer to come back to our baseline or to how we were earlier. And this normal changes that the body and brain goes through is often how we learn over time to regulate our emotions as well. So regulating our emotions or managing our emotions is essentially a skill that we learn with time. And there are people around us that are called co-regulators who actually help us deal with these emotions as well. Now, when we are faced with negative experiences, it could be any life event, it could be adverse events, that the ones that we're all going through of uncertainty, we are pushed to the edge of this arousal. And this window of arousal is at its brink, and some of us might actually come back and adapt, while some of us may not be able to because the window of tolerance is actually shrunk. And as you can see that there are signs of distress that are commonly experienced during this time. There could be signs of either extreme distress, some of which is optimal, that might actually help us react better as well. Now, a lot of the countries have faced, there is a global challenge that we're looking at. And I think when we talk about human disaster, natural disasters that occur to us or medical emergencies, there is always a psychological preparedness. And at the same time, some kinds of medical emergencies or disasters challenge us much more because we are not prepared for it. And the COVID-19 is one such challenge, which is not limited to medical emergencies, but perhaps has had a bigger impact in terms of social, economic, and various other relationship implications itself. Now, the very nature of the pandemic has led to a lot of uncertainty, and I think as it moved from one country to another, we realized that our responses were very different. I'll also be looking at some of the concepts related to how there are thresholds or differences that people have in terms of this intolerance to uncertainty, and what could be done in terms of increasing psychological flexibility and thereby reducing this distress or this intolerance to uncertainty. And what are those skills or strategies that are going to help us, and what implications do they have for us? Now, as human beings, wherever we are, we constantly strive for predictability and control, and it could be in our everyday little activities that we do, but it could also be in various larger events in life that we're constantly striving to control, have predictability, know what is going to happen. And we all do this on an everyday basis by maintaining a routine, by knowing what schedules we have for the day in the office, what time somebody is going to meet us. And sometimes our days are so packed that there's very little time for self-reflection or appreciation. And the result, of course, is that we become over time extremely task-driven, result-oriented, and then slowing down is not acceptable at all. I think what we've seen since early this year is that a lot of that has been challenged extremely because a lot of us have been forced to stay back at home and work in different environments, take up new challenges, respond very differently at very short spans of time. And we've actually had to do a lot of change in the way we have been working and living as well. Now, this task-driven, result-oriented way of functioning over time is often reinforced at various levels as well. And we find that as we're growing up, right from school years or college years, we are often reinforced for being very organized, for having a lot of packed days, and this becomes part of our repertoire, so much so that we're unable to think flexibly. Now, very specifically to this context of what psychological responses, and much has been written, I think, over the last few months on the impact of mental health in this context itself. So why is it so important to understand is that any threat is difficult, and any threat allows us to pick up responses and deal with it. However, the nature of threat is very important to understand when you're looking at human responses to this threat. And particularly, this has been a very uncertain kind of threat. There has been a lot of uncertainty regarding treatment, regarding what is recommended, what is not recommended, the impacts of isolation itself, and social stigma and responsibility in terms of transmitting, not just acquiring the infection, but also infecting those around us became very important. There was also lack of clarity regarding availability of resources. Its impact moved beyond health to employment, education, and the very fabric that we live in. Now, a lot of times the anxiety and fear were also related to a lot of information that we were getting. For example, we were associated with various helplines, and we found that a lot of people were calling in because they were reading a lot on the news. They were listening to a lot of news on who was affected around them, and this threat-related information actually increased their anxiety and fear. And these were individuals who were already vulnerable. There's also an increased sense of helplessness and frustration and boredom, because this is largely because of the lockdown itself, and almost all countries went through it. People were unprepared with resources. They were stuck and separated, students in different places. And of course, we are aware of what is to come in terms of job insecurity and future concerns with conflicting information. Now, how do people deal with uncertainty itself? And we know that uncertainty is something that is a part and parcel of everyday life. It's just that we pushed it to the background by trying to exert as much control as possible. But when it exceeds what is normal uncertainty or intolerance to uncertainty, often people manifest this by excessive worry. And we might have gone through it at some point or the other by trying to get answers of why did something happen this way, what can I do to solve it, how do I get to the bottom of this, and that manifests as excessive worry, or what we call rumination. We also find that once we are distressed by having so many worries, for example, if someone is not able to sleep at night because I'm worrying through whether I've made the right response, what will happen, one might also try to control thoughts. And this is something that may appear in the initial part as a very positive strategy in terms of reducing time spent in worry and being more productive, but then it also leads to being counterproductive over a period of time. On the behavioral front, people try to deal with uncertainty by micromanaging, and we've all seen people around us on a day-to-day basis, even out of the COVID context, who try to control every little action in their office place or at home. And for some individuals, waiting to act only when all information is available might actually lead to procrastination. So what we're seeing here is a trait-like factor, which is known as intolerance to uncertainty. And this is not limited to the present situation, but the present situation has highlighted that this is a definite vulnerability to negative emotions. I'm not able to move the slides, I think. You see the next slide? Yeah.
Ma'am, can you try changing it? Yeah.
Yeah, I've changed it. Thank you. So what this all leads to is we're actually working, and I'm just now pressing buttons to make things work, but in a lighter note. But then we also have what we call as an autopilot mode, and a lot of us end up working as if buttons are pressed. And you may have experienced, reaching somewhere and not knowing how you drove and reached there, because you've actually been thinking and planning the day over and over to see how meetings will go or how a certain event will take place. And so we end up doing rather than being, which is much overlearned. The downside is that a lot of us may actually lose the ability to think very flexibly, because we are using and generating everyday solutions to everyday problems, and we are often not required to generate normal solutions on a day-to-day basis. We simply accept that there is no need to act and just go on generating everyday solutions that are not really flexible. Now, the question, of course, is whether the ability to handle uncertainty and to adapt is something that comes up very importantly here. Also to remember in this context is that what contributes to these negative emotions is the negative appraisal of events. That is, what does the event mean to me at all? What does it mean to me personally, and what does it mean to me and my family, which might give rise to feelings of helplessness, frustration, and anger. And most of these are, of course, in response to a lack of control. So uncertainty and lack of control often go together, and you might see this in responses to get things back in control. Now, on a theoretical note, the concept or the construct of intolerance to uncertainty is not very new to psychology, and in particular to anxiety disorders. It's defined as a fundamental process that underlies mental health, and it's also the capacity that the responses that come in when there's absence of sufficient information. And this sufficient information could be how I define what is sufficient information. So when they sure they have to know things perfectly, and they also do not want to experience any problems, what we know on a technical note as an experiential avoidance. When we say experiential avoidance, we're actually not avoiding the situation, but we're avoiding the experience of anxiety that a situation brings to us. And so we might want to have everything ready before we actually get into a decision making or a actual situation that we have to be in. Now, what this means to us is that intolerance to uncertainty may be present in many individuals, but in some there is a greater vulnerability because the amount of intolerance is greater. And these are individuals who might also develop greater distress as well as use more maladaptive strategies to deal with the anxiety that comes. Now, how do we manage negative emotions, which is the focus of the presentation next part? Now, understanding emotions is very important to begin with, and this is just an overview of how we could actually break up the various strategies within it. And the first and key step is to be able to understand by monitoring our emotions, behaviors, and thoughts, and there are various ways which we can do it. The next strategy would be to actually look at what are behavioral patterns that are actually maintaining these difficulties or the emotions. What is it that I'm doing that doesn't allow me to experience emotions and deal with it more adaptively? There could also be reduced ability to solve problems. Therefore, I'm using worrying and thinking as a way of problem solving. And I could be using other ways of being excessively perfect in order to deal with uncertainty. And this is taken up in the cognitive or the thinking-based strategies, which are basically looking at what are meanings attached to uncertainty. What does it mean for me for things to be not completely clear or sure? How can I allow this emotion to just rise and fall and not look at perfect answers? How do I let go by looking at radical acceptance and deal with unpleasant feelings? So the whole way to look at this is actually the emotion regulation strategies. And emotion regulation is on a continuum. And we look at emotion regulation theoretically as a set of skills which are complementary in nature. There are some which might be used even before we get into an unpleasant situation. For example, if we are meeting someone we are not very comfortable with on prior meetings, we might schedule a shorter meeting, or we might try and send an email instead of actually meeting that person. Now, all of those strategies may be even before the experience of anxiety is felt, but we could also be using what are known as response-focused strategies, which occur after the experience of emotion has started. And some of these are like relaxation strategies or meditation on the positive note. They could also be using substances and other maladaptive strategies to deal with the emotions themselves. So the first step is self-awareness. And when I said self-monitoring, we're basically tracking not just our emotions, but also our thoughts and behaviors, because in a way, they are a vicious cycle which feed into each other. So what can I ask myself? When do I typically engage in this worry or rumination or this particular behavior, which is a key step in enhancing self-awareness? How long does it last if I'm stuck in a state of ruminations or worry or feeling negative? What happens when I do not think about my problems or I try to suppress? Does it actually go away? What sensations or emotions do I experience, and what do I become most aware of? Is it palpitations? Is it headache? What is it that I'm experiencing mostly? And what do I experience as my beliefs? What are my beliefs about these, both the emotions as well as my behaviors? So when I have a strong belief that I should not be experiencing distress, I would try very hard not to experience it, and I might end up using counterproductive strategies. Getting stuck in a vicious cycle of thoughts and more thoughts and avoidance, breaking this whole cycle is very important. And one of the key strategies, which is very well researched in depression and also very well researched in problems that are characterized by worry and rumination, is what is known as behavioral activation. And this is a program that actually helps us cut off the endless supply or chain of worries, depressive thoughts. What it does, it actually increases activities which are meaningful or value-based to the individuals. Now, there are various components within the behavioral activation program. It is usually something that we could contextualize to our problem. For example, one could shift activities to something very different so that the whole cycle the habit is broken. One could also look at behaviors such as excessive reading, for example, about health-related information, who will be infected, what am I in that danger zone. So checking and reassurance, which could actually give rise to more questions, could be cut off. Tracking ruminations to actually see a baseline distress, and then looking at both value-based activities as well as activities that enhance mastery and pleasure, so that the whole vicious cycle is not only cut off, but more adaptive strategies are also enhanced. Now, a part and parcel of uncertainty is the physiological response, and we're all familiar with the fight or flight response, which is basically preparedness of the body to either face the situation or have enough energy physiologically to get away from the threat. And this might be manifest in terms of increased blood glucose levels, palpitations, all of which are producing enough energy to deal with the situation. But like we discussed, the window of tolerance, when it becomes persistent and beyond threat, the threat is over and we're still experiencing these symptoms or these changes, it might end up impacting sleep, our attention and concentration, our appetite, and have a lot of other ramifications. Now, one of the most tried and tested methods to deal with physiological arousal is learning the skill of relaxation, which is basically going to target the sympathetic nervous system activity and increase the parasympathetic nervous system activity. Now, there are a variety of methods available, and we usually suggest whatever the person is most suited to or finds it easiest to start with. For example, diaphragmatic or deep breathing might be the easiest. Progressive muscle relaxation, which involves a series of tensing and then relaxing muscles and then staying in that state for about a few minutes, becomes another way of relaxing. But remember that there is a need to have sustained and regular practice and noticing what changes one is actually experiencing. Now, a key factor for maintaining negative emotions in such times, and particularly uncertainty, which gives rise to negative emotions, is to look at what ideas, beliefs, and expectancies I have. So people could have positive beliefs about worrying as well. A lot of people believe that I'm at least doing something about the problem, if not actually taking action. But what worrying actually means is a lot of inaction. And the negative beliefs about worry are what people actually get very distressed about, because I'm now not able to stop those worries when I want to. So one of the key ways that we suggest is to actually monitor the worries about worries. And also that worry is something that through little experiments, one can show that by setting aside a worry time, we know that worry is fairly involuntary. You can't sit and worry deliberately at some point of time. So suggesting worry postponement might be important for ourselves. Now, at a belief level, one could also challenge the need for certainty. So what is the worst that can happen, and what would you do if that were to happen? So people believe that certainty is a must and everyone must know things in detail. However, there could be many situations which have actually been dealt with where things have not been entirely clear. So you could look at what is the need for certainty. And many people also believe that it's intolerable to have uncertainty in part of your life and things have to be structured and predictable. So these beliefs are challenged and these beliefs are questioned and looked for in terms of evidence and the pros and cons, so that you're working on the underlying thoughts and beliefs. And this is something as a self-learning is also very important. Now, a key thing related to uncertainty, which has had much evidence, is having to have perfect solutions. So if I've reached a solution, I'm not happy with it, I might keep looking for solutions and spend a lot of time counterproductively doing that. So what we've known is that people try to solve problems by thinking a lot, and worry, in fact, if you've noticed yourself worrying, you might notice that you're actually solving problems mentally. However, you might actually not use all of the thoughts or strategies that you were thinking of, because the whole situation might be very different. But people do believe that worrying itself is a problem-solving strategy. On the other hand, they might actually lack the core skills involved in problem solving, which is a very cognitive and a behavioral process where very systematically we generate solutions, we look at various adaptive strategies and resources that are required. Now, engaging in maladaptive strategies instead of worrying, for example, avoidance instead of solving a problem, might also be something that we need to address. Now, we find that when we are faced with difficult situations, and where we are not very sure, decision-making difficulties are often the state that we are in. And decision-making strategies are very closely linked to the constructs that we are discussing, because we want to put off things unless we're very sure of certain things, and goes with procrastination as well. So what we're essentially saying is that along with arousal reduction, looking at beliefs underlying the need for certainty, one must also emphasize on working on actually developing skills in both decision making, some amount of risk taking, and modifying faulty beliefs related to problem solutions themselves. Now, worry is a form of avoidance, and literature says that it's a form of cognitive avoidance, like I just said before. Now, learning to embrace the inevitable uncertainty of life, I think the prayer that we began with was very apt, which talked about uncertainties in life. Now, for many people, this is absolutely unacceptable. And so we have a lot of what if questions which are endless. And we ask ourselves, am I asking questions to which there are no answers? And there is an endless fund of such questions. So we're moving towards acceptance and greater flexibility. Although it might sound quite the opposite of what people try to do, it's often important to look at how one could take a very radical view of dealing with uncertainty itself, struggle, and the need to find exact answers. So here's where we come to this construct of psychological flexibility, which has increasingly been talked about, because we are looking at the antidote to uncertainty. Essentially, we're looking at what is the impact of non-acceptance. So as you see in the diagram here, there are a lot of processes, 6 processes, which Hayes has talked about in his approach to acceptance and commitment therapy. But this is something that we can all use in everyday life. So most of us, sometimes we may feel stuck in the past or present, which is what worrying does to us. And by not being in the present, we often become fused with our thoughts, because we're not able to see the thoughts of worry or anxiety as separate from what is actually here and now. And so these thoughts are seen as a reflection of the true and inevitable rather than just a passing thought, and in turn generates more distress. What it does in effect is it makes us go away from values and action that we are actually committed to. So we might end up avoidance, we might end up not engaging in activities that we were otherwise committed to, and there's a vicious cycle that is set up. So what is suggested in terms of developing psychological flexibility is to adapt to what is known as acceptance, which is a core construct here. Acceptance is not the same as resignation, but it is a part of a cognitive change, or a change in the way we think about situations itself. So it leads to perhaps more creative solutions at the end of it. So we're shifting essentially from a very doing mode to a being mode, just to be with what we're experiencing without trying to struggle. And we're all familiar with the quicksand. If we are stuck in a quicksand, people who struggle actually get more and more stuck in it. So the examples that we were talking about in terms of people who are trying to avoid experiences are struggling to get away from these emotions, and in turn are actually worsening it. So what we are suggesting to increase psychological flexibility is to actually increase contact with these emotions, and the fear triggers, use action instead of avoidance. So what is psychological flexibility? And this is what I was just referring to in the previous slide. It is a construct that is linked to psychological health, and it is something that really has a range of abilities that are a part of it, and let's come to the details in the next slide. What I'd like to say here is that part of psychological flexibility is the ability to accept ourselves, our thoughts, the way we are, and acting on long-term rather than short-term impulses, waiting to see what might come rather than doing something very immediately. And it's also seen that people with psychological disorders, various anxiety, emotional disorders, have lesser psychological flexibility. And so we're actually trying to increase that. And people who have a lowered psychological flexibility are also perhaps more vulnerable to developing distress. And it is related to not just our thoughts and emotions, but also regulating ourselves and our goals and those of others. So what are the components of psychological flexibility? Various constructs within psychological flexibility have been discussed. One is, of course, the ability to recognize and adapt to various situation demands. And you'll see now why it's so important in this situation. Why is it that some people have quickly adapted to change routines, work schedules, lives, and then very quickly had a newer routine that they've got familiar with. It's also part of it is also to be aware and open and committed to behaviors. And this is congruent with what we hold very deeply as our valued actions or valued goals. And in order to allow for this to happen, we must also be open to experiences. The other important thing is to be able to maintain a balance amongst various life domains, because we're torn between various goals in life, and it's important to note that this is part of self-regulation, to be aware of what else is required of us and how to keep a balance between and prioritize each of these goals. And the more important thing is to be able to have a flexible repertoire in order to shift mindsets, and this is not at the expense of personal functioning. In order to understand psychological flexibility, there are various means to achieving psychological flexibility, and one of the ways to do it is to actually use mindfulness. And a lot of you may be familiar with this construct of mindfulness as it is, but just to define it, it's present moment awareness. It's being able to be aware of one's experiences, to pay attention in a voluntary manner to the present moment in a purposeful, receptive, and a non-judgmental way. It's actually known as a mode of processing information. It is a family of meditative practices and comes from the ancient Vipassana meditation, and basically means to view things in a special way. So we are an impartial spectator or witness to our own experiences, thoughts, and our being. So what works in mindfulness? Research and scientific research has shown that there are 5 components that work across various therapeutic approaches in everyday life. One is the non-judgmental aspect and non-reactivity. 2 is acceptance, which we were discussing till now, which is basically a cognitive change. To be adapting or habituating on the habituation process by just staying with the distress. Handling experiential avoidance, which comes through psychological contacting instead of avoiding. And for some individuals, there may be an element of relaxation. So what is the role of mindfulness in enhancing this construct of psychological flexibility? Just to bring together some of the constructs we were discussing, we move to a more being versus a doing mode. And from being in an autopilot mode, we go to a more self-reflective mode or a self-reflective thinking process. Mindfulness also accepts that some emotions are, or some unpleasant emotions are there, and there are certain events and experiences that are unpleasant. So it does not insist on struggling or removing these experiences. Rather, it helps to reduce the struggle. It also allows for more flexible styles of thinking, because this is shown through research in increasing problem-solving ability, in being able to generate more creative solutions as one is being in the present moment fully. Now, how do we use mindfulness in addition to psychological? So psychological flexibility is at the crux of a lot of our discussion today. However, being mindful would also at the immediate point help in managing difficult emotions and bringing it to something very specific. And what you can do here and now is to use breath as an anchor. So at a broader construct, mindfulness may be expanded to looking at understanding oneself non-judgmentally. But if one had to have a means to achieve mindfulness, then using and observing breath would be one of the first steps in it. So asking yourself what is going through your mind right now, what are sensations that are there in my body at this moment? I mean, it could be a tingling sensation, it could be pain, it could be just a pleasant emotion. What emotional reactions and impulses am I more aware of? Remember, you're not doing anything, but just being where you are and going through these various processes. So one might ask, why breath? And if you're familiar with a lot of practices of arousal reduction or relaxation or yoga, meditation, or any simple exercise as well, breath is an important aspect of it. And breath is an anchor which also reflects distress and something that's very easily available to us to be observing. So the how of mindfulness, these are just a few tips that one can be aware of. One is in any part, if you're in the office, if you're driving, just remain aware of feelings, paying attention to how you feel. Some people benefit by keeping a journal because they can then bring it down to actual specific events and what strategies and be able to review them. Listening is very important part of self-regulation and listening to self-talk, which helps you remain focused and composed. And to remember that there is a choice of responding, because responding with an impulsive anger or losing your temper or shouting may be an immediate choice of response that you may have used, but one could also choose other ways of responding. So 3-minute observation of breath is something that we use quite often in everyday practice, because for many people going through a very deep practice of meditation may not be required, and meditation may not be indicated in all people because it might actually produce difficult emotions as well. So the first step is to be aware of the body and notice bodily sensations, and then slowly expand it to breath as one is breathing, a normal breathing, and then to expand this awareness to things around you and the body as a whole. So it could be done for about 3 minutes. And there are some very simple everyday mindfulness activities that one can use on a day-to-day basis. So when did we last remember eating mindfully or slowly? Or brushing and bathing because we're doing it in such a hurry in the morning to leave for office? When you're standing somewhere in a queue waiting for things to move, to observe what is happening within you and around in the people. And a simple mindful walking which involves observing your steps, your pace, and just taking time off to observe things around you as well. Now, like I've said before, mindfulness just accepts that some things are unpleasant, but that it's also impermanent. And if you ask someone, were you angry 24 hours or how long were you angry, is often something that comes and goes. And this is how we use metaphors of either the cloud or you're standing on a train platform station and you're watching trains go by. These are things that are seen as passing events, both emotions as well as our thoughts. And by stepping back and being an impartial spectator, we can actually find ourselves reacting less intensely or less strongly as well. And this is facilitated by increased awareness and flexibility and acceptance. So instead of getting entangled, what you're emphasizing here is to be an impartial spectator and take a different perspective. And you would have also seen that when very involved in a situation, it's very difficult to take an objective stance on things as well. So what prevents us from, using acceptance, because we know it theoretically, and sometimes when people tell us just let go, we know that acceptance is what we should be looking at, but we find it very difficult. So one of the things is using a very overlearned pattern, because we have certain beliefs about change and change being not a very known factor, so we resist and hesitant about change. We're often brought up in environments which are highly self-critical or teach us to be self-critical because we're often bound by rules and regulations. We also associate the fear of acceptance as being a failure in efforts, and therefore we are looking at acceptance. Sometimes we try very hard to make things work for us because we've learned that you have to keep trying if you failed, but it's at the cost of being flexible. Now, sometimes people are also very overwhelmed by emotions because if I actually let go and acknowledge my emotions, I might lose control and that might actually be a problem. So where is it linked to? I was talking about self-criticality, and when we know self-criticality, we also know that self-criticality, the antidote is to be more compassionate and kind to self. And here is where again the links to mindfulness comes, because when you are practicing being mindful, you're not just non-judgmental about others and things around you or the emotions, but also about yourself. So if you haven't done exactly the way you should have in a meeting or presented, missed a point, we don't go through this whole process of beating ourselves up and looking at how we could have done better. So self-compassion is inherently linked to regulating emotions, and difficult ones at that. And literature shows that people who practice self-compassion are often happier, they're less stressed, and over time more resilient also, because it helps us bounce back and deal with more difficult situations with a better frame of mind. Now, how do we build self-compassion? One of the ways, many strategies have actually been discussed in building self-compassion. There are various activities that you'll find on the net as well. But one of the things in Gestalt therapy is by Greenberg, which talks about the three-chair technique, which looks at the critical self, the other, and the dialogue that happens within ourselves, and how we could change or shift this dialogue to something that is less critical. On easier notes, looking at how would you treat your friend, could you write a letter to yourself which appreciates what you've done and how you are in positive attributes? And so there could be a lot of activities that actually helps us look at ourselves in a kinder or a more compassionate light as well. Now, so we've talked about mindfulness, we've talked about acceptance, we've talked about self-compassion, but we also may be facing the question of who actually needs to learn self regulation or emotion regulation. Remember that emotion regulation is for each one of us, and some of us have better skills at managing emotions than others. So it's a matter of varied levels of skills, and some of us are in tasks or jobs that require a high amount of emotional labor and we're exhausted. So we have to put in more efforts to regulate ourselves. Now, this is a universal situation that we're all focused on, the present COVID situation, as well as what it's going to bring forth in the future. But remember that as the fear decreases and as we are actually moving to lesser lockdowns and more realities of the new normals that we're facing, we need to pick up threads of life that become more important to us. And we are now using the cliche term, the new normal. Remember, it's not just one person or one factor that determines emotion regulation. It is determined by several factors, and therefore the monitoring of this becomes very essential. So I'm going to end with a couple of quotes. We know that this situation is not new, because this is something that was said by a poet in 1939, that we've always lived on the edge of a precipice. And when we think we're dealing with a new normal, we know that life has never been normal, but a new situation has come to us that we're dealing with it. And sometime from now, we'll probably have strategies to deal with it as well. What is also important on the positive note is that we've experienced a lot of voices of hope, positive actions, altruism from various, quarters of the society. And these actually reflect inner resources that we're all capable of, but that there are temporarily suppressed for various reasons. So it's for us to look within ourselves for the strength as well. I'll leave you with this quote. It's precisely the uncertainty of this world that makes life worth living. So I end my presentation here, and thank you for this opportunity.
Okay, so thank you very much for that very insightful session, Dr. Sudhir. I know that our participants have really learned a lot from the topic discussed, especially everyone now had experienced the impact of the COVID pandemic to our lives. Now we have come, ma'am, to our question and answer part. So we have received several questions from the Q&A tab here from the participants. But in the interest of time, we will be only selecting questions, of course, to be addressed by you. And if there will be questions that will not be answered for today, so we will be sending you an email. Would that be okay, ma'am?
Yes, that will be fine.
Okay, thank you, ma'am. Okay, to start the question, so there is a question here. Um, the question is, as an educator, how can we lessen the psychological distance between teachers and students, given that most of the lessons will be delivered now virtually?
Yeah, that's a very interesting question because this is a new challenge that we're facing in terms of online sessions. I think it's important to know that you have connected to your students before. So using examples, asking and pausing between sessions so that you make it more interactive, and also reaching out to students and asking how they're actually feeling and what they're experiencing, rather than only keeping it to technical content might be helpful. So I think that would be important to connect to students even though it's online. And I think that's important.
Thank you for your answer, Dr. Sudhir. So another question here from the chat box. What can you comment on the social stigma felt by our medical frontliners? And the follow-up question is, how can we help them, these medical frontliners that encounters this social stigma every day?
I think that's something that we are facing a lot. Recently, we made a video for people for self-care of the helpline workers, the frontline healthcare workers, because they're actually doing so much, but all positive. And I think we've all read about how people, come back home and are experiencing stigma. So one of the things is to reach out to your fellow professionals, because I think literacy about COVID-19 is increasing, and as I see, there is a little less in terms of stigmatization, because that's what the larger systemic interventions have also played a role in. The other thing is also to look at whether you could rope in support from within your own team members, within your family members, to see how they could help you reduce this stigma. And the other thing is the internal or the self stigma that is very important, which a lot of us might go through, because if particularly it's a nurse worker or it is a I think self stigma is something that they learn to deal with also, because going back home and feeling that I might infect my family members, am I is it all right to go back? These are things that one should also be able to be aware of and deal with. Here is where being kind to oneself, or being aware that you're doing your task, being appreciative of oneself is very essential. So the component of self-compassion, self-criticality is important here. That apart, I think systemic interventions are very important.
Yeah, you're right, Dr. Sudhir. You know, there are so many medical frontliners, especially now in the Philippines, that of
Yes,
course
yes,
have died because of the infection from the COVID
yes,
pandemic in the
yes,
risk of
yes.
the hospitals.
Yes,
And
and they
this
also
medical,
have to go back, yeah, to their families and be as anybody else.
yeah. And we, of course, we also need to protect them because they are only the ones, curing
Yes,
and treating the patients
yes,
from the hospital.
yes,
So that
yes,
social stigma really had
yes,
a mental impact on our
yes,
frontliners.
yes.
Okay, there's
What?
thanks
Sure.
for that, Dr. Sudhir. There's also a question, something on mindfulness. So there's a question here. Do you think mindfulness is an effective way to ease the anxiety of people who have been affected by the pandemic? So there's an example like loss of jobs, death of a family member due to COVID-19. Why or why not?
So let me clarify that mindfulness is one of the processes, but practical solutions and action should also be part and parcel of problem solution. So if I'm looking at job insecurity, just remaining doing breathing meditation is not going to help me. Allow me to and being able to apply for jobs and look at alternatives. So it helps me keep balance between very difficult emotions, so that I don't lose balance so much that I become use maladaptive strategies of avoidance or stay at home and be withdrawn. So for certain conditions where emotions are very intense, a person could use mindfulness as one of the processes, but it is not used in isolation. It should be used with other problem-solving methods if that's what is required. In the example of the grief, it's also important to understand that acceptance may be one of the processes that are very essential here, but then loss of a loved one due to an infection like this might also bring forth a lot of guilt, because here we saw a lot of instances where maybe the son infected the mother because the son traveled back from some country, and then it was the son who infected the mother, and this is what the press brought forth. And so there would be a lot of guilt along with that grief. So here again, mindfulness might be one of the vehicles of change, but not the only vehicle of change. So there will be other cognitive processes as well.
You're right. You're right, ma'am. And of course, talking about the effects of the pandemic,
Yes.
giving the impact of this to our lives. So
Yes.
it's really hard, to cope with this kind of situations.
Yes.
Okay, for the last maybe 3 or 4 questions. So there's a question here, because I think it's on a more on the layman's perspective. Because as a clinical psychologist, the question is, how can you differentiate anxiety to worrying to depression? I think it's an evolution. I don't know.
It is an important question because increasingly what we've seen now is people who never had an anxiety disorder or a known anxiety disorder were actually reacting very extremely with hoarding lot of things because they won't be able to go out for some days. So we did see that kind of a reaction. Now, how to distinguish between normal anxiety, sadness to depression is looking at how functionally they are and how it is impairing functioning, the intensity of their emotions, and whether they're able to go about their day-to-day activities despite this distress. When it starts impinging on functioning and their thought processes, then that's when you look at whether it has crossed the threshold to now being a disorder. And of course, the other criteria in terms of sleep and other factors also being affected.
Yeah, because that's the thing for a lame,
Yes.
just for a normal lay person
Yes.
to differentiate
but it's important
between.
to know that.
Yeah.
Yes.
Yeah.
And why it's important is because proving with simple assurance and other strategies to a medical professional for help.
Yeah, especially for depression, right, ma'am?
Yes, yes.
We really don't know if that person, and of course, the worst case scenario for depression is suicide. So that's the crucial thing that could happen to a depressed person.
Right. Yes.
Okay, let me. Sorry, ma'am, for so many questions, but I'll be just providing maybe just the last 2 or 3 questions. So there's a question here. Can holding strongly on single value system helps overcome stresses in life?
I'm not sure what is a single value system, but anything that is very rigid can also become a problem, because I could hold a single value system, but I may be aware of others that are not as important in the hierarchy, maybe within me also. But I should be able to be open and aware that there are other coexisting value systems as well.
Yeah, that's good to know your value system, of course,
Yes.
and accepting
Yes.
this kind of, especially in this time of uncertainty.
Yes.
Yes. For the last 2 questions, ma'am. So there's a question. I think it came from a parent. So, what are the ways we can help teach our children on managing emotions when we as parents are having difficulty managing our own in respect to role modeling?
So I would always recommend that parents are role models. Of course, children have different temperaments. So not all children are easygoing. Some children are irritable, or some children are very easy to be with. Parents are role models, so I would always suggest that parents first work on their own emotions, so that, for example, if I use worrying as a coping, every little thing that child comes up with, I'm worrying. So that would become a part of social learning for the child also. So emotion regulation skills are part of the socialization process. Parents have effective ways of resolving emotions. Children also model after it. That's just one of the ways. And remember that it interacts with the child's temperament. So if there's a child who's very difficult and stubborn and a parent who has very low tolerance to frustration, it might actually mean a lot of fights and arguments at home. So it's a combination of both that has to be looked at.
Yes, because of course the children, because staying in one house, so that those children
Yes,
will be seeing their parents, you know,
yes. How
worrying,
they're,
sitting in the
right.
corner, lost their jobs. So that would be
Yes,
also a thing
yes,
that what you have said to help
yes.
parents to cope
They
with.
could also see positive things that the parent is trying other positive things, or there are hobbies, or there are, family rituals, good practices that are going on. A lot of positive things can also come out of this.
Yes, you're right, Dr. Sudhir. Okay, for the last question, okay, let me have uh okay, I think this is something on, you know, the distance or the psychological distance. Okay, before we would help someone experiencing difficulty or uncertainty by physical presence of friends and family. But because of the current pandemic, we are limited to do so. Do you have any recommendations on how you would cope with this situation?
We've substituted physical distance with video calls or conversations. It shouldn't stop us from connecting, which is why the term social distance didn't seem very appropriate, because we actually encourage or friends just to ask of how you are. And I think that matters more than just physical presence, which is not possible at time. But technology has helped us a lot in this process as well.
Yes, and I think I have read also something about telemedicine. So you know, just doctors
Yes,
doing the mode of communication in online for their for their you know, having this
yes,
conversation with
yes.
their patient.
Medical
Uh,
treatment.
just this is a personal question, Dr. Sudhir. So do clinical psychologists like you also do like that, the telemedicine one, especially this kind of COVID pandemic?
We are doing that now because we just recently released guidelines for psychotherapy in our country as well. And we've had to use both telephone as well as their clients are comfortable with video-based sessions, because so we've adapted as well.
Yeah, okay.
Because there are limitations and there are ethical uses of that practice as well.
Especially for, you know, the therapy sessions, right? So
Yes,
most of the time it should be
it
done
should.
like on a
Correct.
physical setting.
Yes, yes, and
Okay, but anyway, so
confidentiality and
yeah,
correct.
yes, you're right. Oh, so we have still questions here, Dr. Sudhir, but of course, in the interest of time,
Then,
we would
yeah,
like to, yeah, we just send you maybe an email
sure,
for these
sure.
questions. And of course,
Yes,
we thank you for answering all of the questions from our
yes.
participants. We really indeed learned a lot from these particular sessions. Um,
Thank you.
yeah, thank you very much, ma'am. Pawan, can you give me the presenter rights? So I'll be just making some announcements before the end of the webinar. Thank you.
Before we go, and Dr. Sudhir, do you have any last words for our participants?
I'd like to thank everyone for, I know it's late in the afternoon for you. I'd like to thank everyone for joining in for the webinar, and of course the organizers as well for making this and giving me this opportunity to make the presentation as well. So thanks a lot.
We are very much welcome, Dr. Sudhir, for having you as our resource person for this very timely topic.
Thank you.
Okay, so let me give like some announcements for the participants. So as what we have mentioned earlier, especially on the webinar guidelines, so certificates or the digital certificates for this webinar and the PDF format of the PowerPoint presentation of Dr. Sudhir will be provided through email for this webinar. And again, in behalf of the EBSCO Philippines, we would like to thank, of course, our resource speaker, Dr. Paulomi Sudhir, our Vice President for South Asia and Southeast Asia, Mr. Shaji Jan, our marketing, Pawan Kumar, and our EBSCO India colleagues, who have supported us in making this Part 2 live webinar possible. And of course, to all of our participants, not only in the Philippines, but around the world. Maraming salamat po. And before we end this session, I would like to take this opportunity to invite our librarians tomorrow, June 5, 2020, so that's Friday, 8 o'clock in the morning, to join us for a roundtable discussion with your colleagues where they will discuss things from remote usage to using social media to promote library resources. Come with a full cup of coffee and ready to share your experiences and ideas. Our panelists include our very own Dr. Fernan Dizon, the Executive Managing Director of the Knowledge Resource Center of the Asian Institute of Management, together with Mr. Chris Chan from the Hong Kong Baptist University, and Margaret Allen, the Chief Executive Officer and State Librarian, the State Library of Western Australia. Please scan the QR code in the screen or capture the link to register for free for this webinar. Again, this is Bon Sigisabal, together with my colleagues Joseph and Sher and the EBSCO India team, saying thank you, stay safe and healthy, and see you again on our next webinar. Thank you.